a year ago. And the way she came here, I looked on the internet and I, sorted through people because I lived in Fernandina, and there was one guy there that did a lot of people's eyes, but he was not as good as I wanted. His outcomes were not as good as I wanted. So we came here, and Judy had hers done, and she always wore glasses before to drive. Now she doesn't. She hasn't since the surgery. We had basically, I think, clear lens, and so she has reading glasses, but otherwise she's 20/20. And I just went in there and I had 20/30 before I went in. I had 20/20 now. The day after.
Wow, that's great.
The day after he did my right eye, and he did the astigmatic keratotomy as well. So I'll tell you, he's the maestro as far as I'm concerned.
Yeah, absolutely. Now, I wasn't one of his patients this week, but I was a patient 3 years ago. The way I ended up there is that I'm from Fernandina also. And my eye doctor in Fernandina, I had RK surgery about 20 years ago, and they didn't realize at the time that RK was pretty much a failure. And I was losing my vision very rapidly. My cornea was warping, and my doctor said, the only person I know that will even touch your case is Dr. Gulani. That's the person you have to see. He said, no one else is going to go in and mess with your eye, because as soon as you touch it, it's going to shatter.
Wow.
So, and now I don't wear glasses. Occasionally, if I'm going to read for a long period of time in dim light, I'll use readers. But other than that, vision's perfect, and that's what brought me up.
But he broke your leg, right?
He does ankles, too.
20/20 vision. But my wife brought me here, and she had to come back last month for YAG surgery and to clear up a little bit of cloudiness that was left after the cataract. And I'm a recently retired pilot, and I wasn't able to get the cataract surgery while I was still an active pilot because I lose my medical. So I retired last December, and we were here, and I started talking to Dr. Gulani. Well, what can I do? Should I do LASIK? And he goes, you're wasting your money if you do LASIK. We can do the cataract now. You'll never have to have that done again, and I can correct your vision at the same time. And just his forward thinking, instead of going, yeah, I'll do LASIKs, and 5 years from now I can do cataract surgery on you and make a big bundle. No, he does it. He looks at the most progressive way to do something, and that's why he's so great. Thank you, Dr. Gulani.
Please don't tell me you were flying blind.
Flying with glasses.
Well, I like the way he takes each case individually.
Yeah.
He says he comes in a day before,
Yeah.
he programs everything out so that he knows exactly what he's going to do on that particular patient. Instead of like this man might have pretty close to the same thing that he does,
Yeah.
but he does them different.
Yeah, absolutely. To get the same end result,
Right,
you know.
right.
Well, he has a vision for what he is doing, which, I mean, to double up on that word, I mean, he does have a vision of what he's doing. It's like, and that's why it's Gulani vision. He has a purpose that is clear and visible to him when he wakes up in the morning, when he goes to sleep at night. I believe that.
He must
I-
dream eyes.
Yeah.
He must dream eyes.
My story?
Yeah, you're up because my wife and her
She spoke out of
shares
turn.
a habit in her family.
Oh, mine's probably going to be kind of boring, but I've been wearing corrective lenses since I was 2.5 years ago. We won't talk about how long ago that was.
Years old.
2.5 years old.
I was gonna say,
2.5 sounds better. But so I've lived with them all this time, and And I was one of the first of the group that was able to get contact lenses. My correction with glass, or my vision without glasses when I was 2.5 was like 2,600. So I was bumping into walls when
Wow.
they recognized I needed help back then.
Yeah.
They had to
So-
be that fit.
It was a blessing to me when they came out with contact lenses because that was the only thing that would really help my vision, and I became a airline transport pilot, believe it or not.
Oh, wow.
Yeah, but it was all private type, commercial or corporate flying.
Uh-huh.
But as the years went by that I wore the contact lenses, which were the hard, gas
Yeah.
rigids, it got to where I couldn't wear them very long. And I remember checking even 15, 20 years ago when they first came out with LASIK and hoping that it could be used. And at that time, they said with the condition I had, it was too risky. And all these years, I've still been told that same thing. I went in and had lens implants, I guess about 12, 13 years ago. And that was to relieve some of the problem with contact lens wearing. So that got me through about another 10 years anyway. And everybody kept saying that's kind of the end of the line. Glasses really won't take care of the keratoconus. It wouldn't help the condition. So I thought it was pretty well just going to be downhill. Thanks to her, she was at our eye doctor one day, overheard a conversation about Dr.Gulani, and that's what brought us here. And as you know, he's the only doctor I ever sat down with that said, you know what, here's, as a matter of fact, what he did, he sat back and he thought about it for a little bit, and then he said, here's my plan. And then she explained to him how, you can't ever understand what he's looking at through all these years, without correction, of course. And it was just so refreshing. And it was actually emotional, as you know, because of the fact that somebody actually understanding perhaps what you've lived with for 30, 40 years.
Yeah, right.
We'll give you that.
So that's about it. So I'm excited.
Great story.
I said, we're very boring too for one story.
That's great.
We talked to our family physician, maybe we're getting cataracts, any idea who we should go see? And he says, do not ask those who not want to do it. He's had his eyes open. So we did the first two last Wednesday and the second two yesterday. We're done.
And I follow her wherever she goes. I think the great thing that impressed me about Dr. Gulani and his staff is that
don't forget his staff.
they're so hospitable and knowledgeable. And it makes you feel very, very comfortable and have some confidence in what he's doing.
Yeah, and when it comes to your eyes, you need confidence.
Right,
Exactly.
exactly.
Yeah.
Yeah, you guys were pilots. I was a naval submarine officer. And I had to have 20/20 vision.
Yeah.
And over years, the cataracts and everything just degenerated. And so I'm having a ball.
Yeah, that's great, isn't it?
So liberating. I did find out